Thank you so much for tuning in. This is our breaking news story this hour. 2 children have died and 5 others remain hospitalized following a suspected food poisoning incident in the Eastern Cape. The Eastern Cape Department of Health says 7 children aged between 4 and 7 years were admitted to Cecilia Makiwane Hospital with suspected food poisoning. The children presented with symptoms including vomiting, diarrhea, as well as dizziness. 2 children were declared deceased on arrival at the hospital despite resuscitation efforts. Preliminary information from families indicates that the children had been playing together and consumed snacks before becoming ill. The exact cause of the suspected food poisoning has not yet been confirmed. The department has activated its emergency and outbreak response protocols at the District Environmental Health Unit, which has been deployed to investigate the source of the illness. Now, for more on the story, we're joined by Camagwini Mavovana, the spokesperson for the Eastern Cape Department of Health, to just get a little bit more with regards to the story and a further update. Camagwini, thank you so much for the time. Appreciate it this evening and welcome to News at Prime. I'm not sure if you're able to just share perhaps a quick update in relation to what is the situation with the remaining 5 kids at this very moment. What is their health situation?
Good afternoon, Relay, and good afternoon to the viewers at home. Thank you so much for having us. Firstly, the Eastern Cape Department of Health would just like to say condolences to the 2 families who have lost their very young children because of this incident. As you stated, Arabile, this afternoon at around 3 p.m., family members came to our Cecilia Makiwane Hospital in Mdantsane, and 7 children were presenting with symptoms of food poisoning, those associated with dizziness, vomiting, and dehydration. These children were treated immediately, and unfortunately 2 children passed away, even though our teams tried to resuscitate them on site. The 5 children are currently now in hospital, with 1 child being intubated and moved to Frere Hospital in East London for further specialized care. Upon speaking to the family members, it has emerged, Arabile, that the children were playing together in Berlin. This is the now 6 children who were playing together in Berlin, and they were eating chips and snacks before this incident happened. The children then suddenly became very ill, and that is when the family members called for assistance, and the children were then rushed to our medical facility. And the story right now is that 5 children still remain critical and under care, with 1 child remaining in our Frere Hospital for specialized care, Arabile.
Have you been able to speak to, or whether it be authorities or your district environmental health unit, have they been able to speak to the establishment which the parents have said these snacks have come from and may be the cause of this illness?
I think it's just important to state that we are taking precautionary measures, and we also activated our units immediately to go to the site where this particular incident happened. And our environmental unit is still there. The NU12 police from Mdantsane were also alerted, and they have cordoned off that particular area. And I think, not to cause speculation, but we just need to be very careful about speaking about where the actual snacks came from. Our environmental team will process all that and all the testing from that particular area. And I think once we have comprehensive information about where the snacks came from and which facility, or which shop rather, these snacks were bought from, then we'll be able to come back with information. But as of now, the families around this particular area have been informed. Police have cordoned that area. Environmental specialists are also there testing, doing lab testing rather, and I hope that once we have sufficient information, we'll be able to come back on the show even tomorrow to update the viewers about this incident, especially since 2 children now have passed away between the ages of 4 and 7 years old.
Yeah. Camagwini, have there been any previous incidents of this nature in and around that area, only to try and establish any kind of resemblance, if there even is one? Of course, this does not necessarily speak to it being a definite case of the situation, but anything of the sort happened in the area prior?
Not in this particular area, Arabile, but I'm sure, as you may have known, it was also reported in Newzroom Afrika very widely. Last year, we had incidents of this nature, and I think there was an entire governmental response speaking to this particular safety hazards and, food safety, particularly from spaza shops and local shops that provide food, for our communities. And there was an initiative driven by government to ensure that spaza shops are legalized, that they operate within particular frameworks. And Mdantsane was not particularly part of, those incidents that occurred, especially in this area, Msinzi. But this incident has now happened, and I think it's just up to us as government and specialists and our laboratory guys to really find out what happened, where these snacks came from, and to just make sure that nothing or no other incidents rather happened, in particular in this area, Msinzi in Berlin.
Yeah, and I can imagine that the registration of that establishment in Msinzi and the surroundings and related to this case would be of keen questioning as well. Let's just talk very quickly about support for the families in relation to this incident. What support is the department offering at this stage to them?
So right now, our focus is on treatment and just supporting the families. As I stated, that the 5 children who are between the ages of 4 and 7 are in our healthcare facilities, and they are getting the best of care. One was immediately moved to Frey Hospital. So our clinical side of things has been taken care of, and we're just making sure that these children receive the best of care. We are also providing psychosocial support to the families, as some of them are still at our facilities, and we're just ensuring that our psychologists and our social workers are on standby to assist and to continue to support the families and just the community at large. We will also speak to the Department of Social Development in the province about stationing social workers that side, and just to not create any kind of alarm or panic within the community. This is a tragedy that should not have happened, and we just want to make sure that the people in that community as well are taken care of and that they understand what has happened, and we will be communicating with them post us getting those results as well. But from the Department of Health side, I was just to focus on the care, and we are providing that care, and we'll leave everything else to laboratory tests and our environmental unit and police at the moment.
Camagwini Mavovana, thank you so much for giving us this update. We'll continue to try and get more from you, of course, as it continues to flow throughout the next days, hours, and even the next weeks or so. The spokesperson for the Eastern Cape Department of Health there.